Nothing lights up a room like a beautiful smile. For most people, an appealing smile is an important part of a first impression. But statistics show that about half of Americans are dissatisfied with their smiles, mostly because of crooked or misaligned teeth, problems that can be easily solved by braces.
Well, basically, orthodontic problems fall into two distinct groups. You've got those problems that are cosmetic in nature, which includes crooked teeth, crowded teeth, misaligned teeth, teeth with spaces or gaps. And then you've got problems of a functional nature, which are bad bites, overbites, cross bites, open bites, all different varieties. Most patients have a combination of these problems, so that each patient becomes very unique. It's not one size fits all.
Dr. Bruce Bentley has been practicing orthodontics since 1987 and is board certified by the American Board of Orthodontics. He says though an orthodontist can enhance a smile at any age, there is an optimal time period to begin treatment to ensure the greatest result and the least amount of time and expense.
Girls typically mature earlier than boys, so the optimal time for females may be sooner than for males. But on the average, for females, it's generally around age 10 or 11, and for boys, usually around age 11 or 12. But this can vary. For instance, we may have a 7 or 8-year-old that's being teased at school and it's having a negative impact on self-esteem. For that particular patient, we may want to start earlier.
But braces aren't just for kids anymore. Tooth alignment can be changed at any age if your gums and bone structure are healthy. Orthodontic treatment at later stages in life can dramatically improve personal appearance and self-esteem.
As we get older, our teeth become less prone to tooth decay, but more prone to problems with the gums and the bone that surround the teeth. When you have crooked and misaligned teeth, it makes it difficult to properly clean the teeth, and that can have a detrimental effect on the bones and the gum that surround the teeth. The sooner these problems are corrected, the better, but it's never too late to benefit from braces.
The good news for patients of all ages is new techniques and appliances that are used today greatly reduce discomfort levels, decrease the time of visits, shorten treatment time, and may allow you to choose from several options.
One of the advancements we have now in orthodontics is clear or ceramic brackets, and we typically use those on adult patients that have some concerns of the appearance of wearing traditional metal braces. We also have clear aligners, but you have to be careful on who those are used on because there are certain limitations. It requires a lot of cooperation on the patient's part to make sure that they wear their aligners like they're supposed to.
At his practice, Central Virginia Orthodontics, Dr. Bentley and his staff of highly trained professionals pride themselves on providing exceptional orthodontic services and personalized patient care. They utilize the latest technological advances to ensure that you receive the most effective care possible. They also want your experience to be easy and relaxing, so their facilities are private, comfortable, and family-friendly.
I had braces because my teeth were really crooked and I have a very small mouth and I have big teeth and they were all jammed.
When I first came here in October, I got them on, but I only got them on my top because my overbite was that bad and they couldn't fit it on the bottom. So after a couple months in the winter, I got my bottom braces on, and then they just put power chains on and they gave me rubber bands to fix my overbite, and then about 2 years later I got them off.
At the initial visit, we do a thorough oral exam and typically take a series of digital radiographs to evaluate the teeth and the bone structures. From there, we sit down with the patient and the parent and talk about the problems that we found, the type of braces we may be using, the length of treatment, and the cost. And for cost, we're always sensitive to the fact that different individuals have different financial needs. So we work really hard to set up some type of payment schedule so that they can afford the treatment that's needed.
Dr. Bentley and his staff feel it is important to analyze each patient's specific needs because in-depth planning leads to superior results and higher patient satisfaction.
When we first came in, Dr. Bentley, he told us exactly what was going to happen, and so expected what was going to happen each time I came in here, and so there were no surprises, and it was all a very nicely laid out plan.
The staff here were really nice. They were really gentle when they were putting it on because like the equipment is huge and I have a small mouth, so they were really gentle and nice.
All of the nurses are very friendly, and they have lots of magazines out in the waiting area to keep you entertained for the small amount of time that you have to wait. So it's always nice actually seeing them, and they want to catch up with you, and they're very nice.
In addition to his orthodontic practice, Dr. Bentley is also a published author, both nationally and internationally, and he says someday braces may be replaced by magnets.
My interest is in developing a system whereby the current brackets and wires that we use can be replaced with magnets and invisible magnetic fields. Up until recently, that wasn't possible because of the size of magnets that would be needed, but we now have very small rare earth magnets that would do the job for us. There's still a lot of work to be done in terms of the technical application and safety, but I think it's somewhere in the future.
A person's appearance has lasting social and professional ramifications. Millions of people have more confidence and a greater sense of well-being by simply enhancing their smiles. Central Virginia Orthodontics. Exceptional care by exceptional doctors for exceptional patients. To learn more about Central Virginia Orthodontics, visit bracesbycvo.com.